Okay, now we're going to go to the last but not least question, which is the Arrhythmia Questionnaire, my third of three: chest pain, heart failure, and arrhythmia. The arrhythmias, everybody asks palpitations. I can't begin to say how many patients have said palpa what, and so I then have to clarify it. Skipped beats, pauses, and a sudden thump on the chest, as if they've had a pause and their heart forgot to beat, and then it suddenly beats. And that's post-extrasystolic potentiation, a fancy phrase for saying increased filling of the heart with increased startling contraction, and boom. So sometimes they feel a sudden pounding. Then there's always the sustained arrhythmia of a rapid fluttering sensation. A fluttering is always the one that comes up most commonly for me. The most important questions, however, are the triumvirate. The triumvirate of dizziness, lightheadedness, and syncope. Now, you're probably asking yourselves, what's dizziness have to do? That's vestibular. Well, most patients don't know the difference between lightheadedness or dizziness. Dizziness is vestibular. It gives you that feeling of the room spinning around you, particularly if you're egotistical, or the opposite way if you're not. Lightheadedness, on the other hand, is this feeling of the blood just draining right out of you, like it's just going out, and you can get a browning out, a gray, you can feel it. The vasovagal history is very important. And syncope is where they just drop to the ground, and it's different from the seizure activity, whereas seizure, they don't wake up, they're befuddled. But syncope, you don't come back right away. A lot of patients drop to the ground and they still feel miserable, but it isn't the same. They wake up and are able to think right away. The seizure patient doesn't. Then last but not least, the family history of syncope and arrhythmias. Is there a family history of sudden death, a history of seizures? Because when you faint, the patient will frequently get this herky-jerky motion, which everybody interprets as a seizure, but is actually just the ischemia of the head and the brain not being able to function, and they get a little seizure activity or mild tonic-clonic motion. And then car accidents and drownings. Why car accidents and drownings? Because what happens when you faint while you're driving a car or when you're swimming? You're in real trouble. So that's it. I just wanted to have you know that cardiology is simple, it's fun. Chest pain, heart failure, and arrhythmia, those are the questions I ask. And remember, you are the best thing to happen to medicine.